Kathy Bridgford, and I'm their host today, and I'm with the Area 9 In-Home and Community Services Agency. Today we're going to be talking about the Senior Health Insurance Program, also known as SHIP, and my guest today is also from our Area 9 office, Terri Hamm.
Hello.
Thanks for coming, Terri.
You're welcome.
And you are the program specialist for Area 9.
Yes,
And you're also in charge of the SHIP program.
Yes.
Well, tell us what SHIP is.
SHIP. Okay, SHIP stands for State Health Insurance Assistance Program, Insurance Assistance Program. And what we do, we are a certified site at Area 9, and we stay unbiased. We're not affiliated with any insurance companies or anything, and we try to help people find the best insurance out there for them with their Part D's plans or their supplement plans. Anything with Medicare, we try to help them with.
So this is for people that's over 60 or over 65?
Well, actually they can be younger because some people are disabled.
Oh, okay.
And they are on Medicare.
Okay.
So, but basically 65.
Okay. Now, there's an enrollment time during the year that you can only apply for this insurance, right?
Yes, that's right.
And when is that?
That is starting today.
Oh, wow. Okay.
That is October 15th, and that runs through December 7th. And you can make any changes in your Part D plan at that time. And what we do at Area 9, we like to get a list of your medications by name, the milligrams, and how often you take them. And then I do a plan comparison. And out of the 44 or so plans that are available that the companies have contracted with Medicare in Indiana, I pick the top 3 so you don't have to go through that whole list. And of course you can pick any of them, but those are the top 3 that have come up with your particular medicines that you give me to do the plan comparison
So basically the best cost
right,
for
best
the
cost,
person
yes,
and the
best cost
okay,
and
coverage. And,
yes,
okay.
because they're so personal to you because of your medicines. So that's what we do, and it's best to call ahead, make an appointment, and so that you don't have to come back a couple times. If I have it before you come in, then we can have that part done for you.
So if a person's like 65 years old, they get Medicare, but it's a good idea to have a supplement?
Yes.
Or do they have to have a supplement?
They don't have to. It's a good idea too because Medicare only pays 80%, and the supplement will help pick up that supplement to the Medicare. And it usually, depending on which plan you pick, it can pay up to the 20%.
Oh, okay.
So,
if a person turns 65 in February, can they sign up right away, or do they have to go just during the October through December?
no, they have what they call a special enrollment period, and that would be 3 months before you're 65, the month that you are 65, and 3 months after you're 65. So there's actually a 7-month window there that you can do that in.
Okay, okay. But if you're already on Medicare, the 3 months is the only time that you can make a change for. So pretty much you're with that insurance company until October through December, right?
Right,
okay.
right. And it's a good idea to check every year, especially if you are on new medications, or maybe some of your other medications, you're not taking them any longer. There might be a plan out there that might be a little bit more cost effective for you. So it's just a good time to at least check. You don't have to switch. I can give you the information, and then you can decide what you want to do.
And so they actually sign up for the program themselves?
Yes.
So you just give them all the information to go back?
Yes, yes.
Okay. And is there any financial help available?
There is. There's one with the prescription drugs. It's called Extra Help, and there are guidelines you have to fall in to get that extra help. But if you fall in those guidelines, you could have your premiums paid you could, there would be no deductible, and then you would have very small copays. So it can be very, very helpful. And then also, a lot of people aren't aware that there are guidelines also for help with the Part B premium, that it can be paid also, that $104.90, and that's going to be the same this year in 2015 as it was in 2014. I just got information on that it's going to stay the same. So that could be paid also, and that would potentially give someone another close to $105 a month. So we're trying to spread the word about that because a lot of people aren't aware of that.
Oh, yeah. Yeah. And you have that information at your office?
Yes,
so
we do.
Anybody can contact
They
you
can
for
contact me, they can come in, I can mail the information, whatever's best for them.
You know, sometimes I've heard people say they don't feel like they don't take that many medicines, and they don't feel like it's, you know, a benefit to have an extra, you know, in Part D insurance. But you know, one of the things that I've also heard is that then something happens to them in the middle of the year. They've been healthy, then something happens to them, and that kind of throws them back into a situation of a lot of bills that's not being paid. So
That's right. If there can be a penalty if you do not take the Part D when you're first eligible, those 7 months, and it's a certain percentage, and then it's going to be tacked onto your premium for life. So it's not a real large amount, but it can mount up, especially after several years and that you didn't take it. And it's always a good idea. Of course, insurance is a gamble, you know, but there are some policies, some plans that are out there that are very reasonable, that some people will go ahead and just take that, and then they have it in case they need it, plus they wouldn't incur that penalty either. So, you know, I think it's around $15 a month.
Oh, yeah.
Yeah.
Well, that would definitely be worth it then.
But a lot of people will do that just to not have to worry about the penalty.
Yeah, yeah. So a person can go just to any insurance company and sign up, I suppose, with them. But then you're taking the risk of, really, is it the best one?
Right, right.
And I've heard you say, you know, today and several times, you really should have it checked every year because things change. And I know people have said, oh, I've been with this one they've treated me well for years. I've had no problem with them, you know. But then when they run the program, we actually run it, it comes out that there's a lot of better deal out there for them.
Right.
So.
And you know, if it's not a lot more, your current policy is not a lot more, you know, you may not want to switch. You've not had any problems, but at least you'll know that it's in line with what's out there.
Right, right. And you said the agency is a certified place for that?
Yes.
Are there other certified places in our area, or?
There's one at the Senior Center in Centerville. Reed Hospital has a counselor now. And so actually there's just 3 of us in our immediate area.
Okay. And if they can't get into the office, like if they live out of our area, like say Liberty or Connorsville, is there any help for them in those areas?
Like I said, I can mail them information. We can do it over the phone. There's a passcode that we can use that we can look at the same thing if they have access to a computer. If it's a time when I can go out to visit, I can do that also. I'm the only one at Area 9 that does this, so sometimes, especially during this period, it might be a little hard to get away, but, you know, depending on the circumstances, and you know, we don't want anybody not to be able to check it, so.
So you basically help 200-300 people during that time frame just by yourself to get all that entered. So that is a lot. So it's hard for you to get out to all of our counties to do that. Now, does anybody from like the Indianapolis area assist you with coming down and maybe making a presentation to some of the senior centers in the area or anything like that?
Yes. There's a couple ladies that will come. You can call me. I can get a hold of them. Actually, I just did this the other day for Franklin County. I didn't think I could get away. It was in Brookville, which is not that far, but it is this time of the year. And so the lady's going to come and do the presentation at the library in Brookville. So they're real good about that. So I do have some backup like that. And they will be here in December also, 1 or 2 days to help out, because it gets really busy towards the end.
I bet.
People trying to get in what they put off to do. So
I bet.
yeah.
Bet. So you won't be taking any vacation days, right?
No.
Between now and
No. But after then.
the day after, huh? Now, is there a site for people that are really good at the computer that they can go in and check for themselves?
There sure is. You just go on to Medicare.gov, and under healthcare plans, you can just push that, and you can basically do the same thing that I do. And if you can't find it, just call me and I can walk you through it. It's easy.
Okay.
Yeah. It's the first year I did it was a little more complicated, but they've really streamed it, so
Made it a little more friendly.
Yes, user friendly.
Good.
So, and a lot of people do that. They'll do it themselves. Once they've done it, they see how, it's not that bad. So,
Well, that's good. So really do recommend to
Yes.
recheck it.
yes.
Now, you had mentioned a little bit ago Part B. I'm sure a person that's on Medicare, they probably understand Part B and Part D, and they're all just parts to me. So what is the difference?
Okay, there are 4 parts. There is Part A, Part B, Part C, and Part D. Part A will pay your hospital insurance, and Part B pays your medical insurance. Part C is also known as an Advantage plan, and Part D is your prescription plan. Now, original Medicare consists of Part A, B, and D. An Advantage plan is a total different thing. This was started several years ago. I'm thinking maybe I don't know if it was when Bill Clinton was in office. They wanted to do another option to just original Medicare. But if you have original Medicare, it's A, B, and D for the prescription. And like I say, Part C is also an Advantage plan. And if you have that, you don't have your original Medicare any longer. You still pay that premium of $104.90, but it goes to the company that you're, as a managed health care plan, the Advantage plan is, and that money goes to them to help pay some of the costs. And unfortunately in our area, the Advantage plan is not very popular because no one really accepts it. And a lot of the, it may be a little cheaper at the beginning, but with all the co-pays and everything, in the end, it's really not. But like I say, there's several hospitals around, I think it's Newcastle and Winchester, they'll accept Advantage plans, but Reed Hospital does not, and that would be considered out of area. If you were to go there, so and that's not good. It can be more expensive, and there, some people say, well, why don't they take it? And there is a lot of paperwork I hear with that, so that may be one reason. I really don't know. I didn't get into that, but and that's because we live in a rural area. If we lived in, Indianapolis, someplace in Florida, the bigger cities, they would have more choices. And, and it's a good plan. A lot of people like them. But this area, it's not real good if you want to go to Reed Hospital for the convenience or whatever. So
What about like Connorsville, Fayette, Memorial?
No.
They don't either.
no.
So
You would have to. There's only 2 companies that sell Advantage plans in our 5-county area, and you would want to check with them while hospitals,
okay.
you know, would accept that before you would want to take it, I would assume. So you may not want to drive all the way to Winchester and Newcastle, even though it's not that far, you know, if people come to visit you or something, you know. So it's just things you got to think about.
Okay. Do you have the listings of Advantage plans in our area if a person wanted to know them?
I sure do. I have that, their phone numbers. I have the supplement plans, their phone numbers, and I can go over what the different plans are, but we don't recommend one company over another because, like I say, we're not affiliated with any, and we want to stay impartial so that we can just tell you the facts and try to educate you to what plans there are, and then the final choice would be left up to you.
Okay. So the first step for people then is, if they're already on Medicare, is to contact you from through the month of November up through December the 7th, right? And then make an appointment with you. Is that what you do?
Yes. The girls out front are real good about getting the helping me get the medications, and then there's a form that we fill out that gives me a little more information so I can get a more accurate plan for you, because there's some questions that need to be asked also. So between the girls and I, we made it last year, so
You'll do it again
we'll
this
do it
year.
again this year.
Yeah. Can anybody get certified to be a SHIP office?
Yes, they can. We do have trainings for the SHIP counselors twice a year, spring and fall. But yeah, if anyone's interested in becoming a SHIP counselor, just call me at Area 9, and I can put you with the person you need to talk to, and we'd be glad to have more SHIP counselors, actually.
The pay's not so good.
No.
This is a volunteer position.
Yes, it is.
So basically, if there's a retired person out there, especially if they were in insurance at some point, I know several years ago we had a retired doctor.
Yes.
That we were very fortunate. He did a lot.
He did a lot.
So, but I think he's passed now. So really anybody would be that has an interest in this or just wants to help people. So it's just like, what, a 4-hour training or 6-hour training or something like that?
At the very beginning, it's like 4 days.
Okay.
Yeah, and then
4 full days?
Full days,
Oh,
yeah.
okay.
It's a little intense in the beginning.
Okay.
But then after that, it's about 4 hours, spring and fall.
Okay.
Yeah.
Okay.
To get the new things that are coming out, and the fall especially, there's a lot of new prices and different things, or premiums either going up or whatever that come out during that time. So, but yeah, we'd love to have anybody that would be interested in doing that.
Sounds like you could use some help.
I could.
So,
but I love it. It's interesting. As I
bet
get
it is.
closer to that too, it's really interesting.
yeah, well, that's what I was thinking. When I get there, I'm just going to call Terri. You know, it's so much paperwork.
It is.
You know, when you turn 65 with the Medicare and the things that's coming through, and even just regular insurance, you get the explanation of benefits, and you know, what did they pay? What does this mean? And I mean, I feel bad for some people that doesn't have any family to help them try to understand a lot of this, and you could be very educated and still be very, very difficult to understand things. So I'm glad that you're there for people to be able to call and be able to help them. A lot of times people just need help understanding you know, the Medicare bills and all of those things, and whether it's fraud. And you kind of look over the Medicare
Fraud part too, yes. Yeah, so if you, it's very important to look at your bills as they come in, your EOB's explanation of benefits, to make sure that you haven't been overcharged, even though it's not going to maybe come out of your pocket. In the long run it is, because if you're dealing with Medicare, it affects a lot of different people. So, you know, it could be something intentional or not intentional. So it is a good thing to always check those and make sure that they are correct.
If I remember, it's called the Patrol or
Senior Medicare Patrol.
Medicare Patrol. Okay. Okay.
Yeah.
And that's a statewide program as well.
As well.
And I think they have been able to track some things.
Oh,
They have found some things that
They have, yes. Yes.
that wasn't a good thing. So
That's right. And you know, if you have an appeal or something like that that you need help with, I know I've helped a few people with that too. Luckily, and it doesn't mean it always will be, but they turned out good. So, you know, don't give up. At least let us try to help you, and I'd be glad to do that also.
and that program goes all year.
Yes.
So,
yes.
And you do some. You go out and visit some organizations or make presentations to groups as well. If anybody needs more information on the Medicare Patrol.
Yes.
Is that right?
Yes, I do.
Okay.
And usually at the different health fairs we go to, I usually have information about the Medicare fraud, and then also the SHIP program. So, but you can always call us and any time of the year to go over anything, any concerns you might have with Medicare. We can, if I don't know the answers, I'll find out for you.
Okay. So can I start bringing you all my bills and you explaining to me?
Sure.
Oh goodness, I do. I feel bad for people as they get older to have to just try to figure all this stuff out. And so it's so wonderful that that there's that program out there in Indiana that helps seniors.
Yes, it is.
To do that. So
it is. I know there's been different people come in with family members with someone, and when they've left, they've said, I don't know how people that could do this for themselves, if they didn't have family. And it is hard because, they're changing all the time, the rules, or everything changes. Just about the time you think you've got it, it changes. So, yeah, it can be kind of hard by yourself. So we're there to help.
Okay. So they can contact you at Area 9, and the number is
765-966-1795.
Okay.
And just ask for me, and I'll get back with you if I'm not there.
And to make an appointment.
And to make an appointment.
Okay. All right. So through December the 7th.
Yes.
Okay. So I think we have a couple minutes left. Can you tell me talk about some of the other things that you do to help seniors? Because I know you're the program specialist there, and that means helping a lot of people do a lot of things.
Right.
So tell us some of the other things that you do to help seniors.
Okay. Well, I work with the caregiver coordinator. I'm the respite care coordinator, where we try to find someone to come into your home and give you a little respite time. And it's a much needed program also. So if you know of anyone that could use some respite time or would want to be a volunteer to come in, I know you volunteer.
I do.
And we appreciate that.
Thank you.
And so we could use more volunteers. And like I said, if you know anyone, or if anyone needs respite time, be sure you call me too. And what we do is we try to match the volunteer up with the your loved one for personalities and everything. And So it's been a very successful program.
You know, one of the things that I've had a couple clients, and I work all week, so I do it in the evening. I stay with someone that wants to get away in the evening. A lot of the people like to have someone stay with them while they go to the doctor's or something like that, and I can't assist with that. But
Right.
but I do for things that people want to go to church choir or
Sure.
sorority or whatever, and they just need someone to stay with them. But what I have found is that I look forward to going, and I get as much out of it as the relief for the caregiver, because it's just a very rewarding, program.
Right.
To go, and the person looks so forward to seeing you. They're with that caregiver 24/7, and to have someone new to talk to is just wonderful. And they don't have to care for them. They just pretty much just sit with them. And,
Right. It is companionship only. There would be no giving medication or feeding or anything like that. Just simple as sitting and talking, reading a book, watching TV. Just
we get ice cream.
Oh, that's good.
So yes, it is. So anybody that is interested in being a volunteer can call you.
Yes.
And there's not a lot of training involved with that, and it can be as much as weekly or monthly.
Yeah.
So,
whatever fits into
their
your schedule.
Okay. All righty. That's a wonderful thing. And then if anybody knows of someone that needs a respite care worker, to call you as well.
Yes.
Okay.
Please do.
Alrighty. Well, we've covered a lot of things today, and hopefully we've gotten a lot of information out to the folks. So pretty much call Terri.
That's right.
And you can reach her at the Area 9 office, and just give her a call and set up a meeting with her, and she'll be glad to talk to you. Thanks for joining us today on Inside Area 9, and I hope you have a wonderful day.